Hello friends, welcome to Green PG YouTube channel. This channel will discuss about high yielding and most repeatedly asked questions for those who are preparing for medical PG entrance. If you didn't subscribe our channel so far, please do it and click the bell icon next to it to receive notifications. Feel free to click the like button and share your comments. Hello friends, today we will discuss about iodinated contrast. This contrast material has iodine in it. Iodine is a radio-opaque substance. Thus, it helps in better image formation. There are two types of iodinated contrast, ionic and non-ionic. Examples of ionic contrast materials are urographene or gastrographen. Urographene is sodium meglumine ditriosate. Another example of ionic contrast material is chondre. Chondre is iophthalmate. Examples of non-ionic contrast materials are iohexol, ioversol, iopamidol. All of these three contrast materials are monomers. Now we can look into the osmolarity of various dyes. Ionic dye has an osmolarity of about 1400 to 1600. Non-ionic monomers have an osmolarity of about 600, whereas non-ionic dimers have an osmolarity of about 300. Another important point that you have to remember is iodine particle ratio in various contrast material. Ionic dye has only one benzene ring. Each benzene ring has 3 iodine atoms. Ionic dye dissociate into 2 particles. Hence, the iodine particle ratio for ionic dye is 3:2. Non-ionic monomers have only one benzene ring. Each benzene ring has only 3 iodine atoms. As it is non-ionic, only one particle is present. So, iodine particle ratio for non-ionic monomer is 3:1. Non-ionic dimer has 2 benzene ring. So, the number of iodine atoms is 3 plus 3 6. As it is non-ionic, it does not dissociate. So, the iodine particle ratio in non-ionic dimer is 6:1. Example of non-ionic dimer is iodixanol. Earlier, when we said about the examples of non-ionic dyes, we only quoted monomers. Here is an example of non-ionic dimer. Example is iodixanol. Iodixanol is the only dye that is isoosmolar to the body. Let's have a look into the side effects caused by contrast material. It is broadly classified into idiosyncratic side effects and dose-related side effects. Idiosyncratic side effect is anaphylactic reaction. This anaphylactic reaction resembles anaphylaxis, but it is not mediated by immunoglobulin E. Dose-related side effect is non-oliguric transient nephropathy. Best treatment available for this dose-related side effect is hydration. Other treatments are using a non-ionic dye, better a non-ionic dimer which is isoosmolar to the body, and last but not least using N-acetylcysteine. Thank you very much. If you listen to this topic properly, you will definitely answer this question. Only isoosmolar contrast material among the following is option A iohexol, option B ioversol, option D iopamidol, option D iodixanol, option E urographene. Yeah, that's it guys.